Good morning.
Good morning, Anne.
It's morning here. We were talking today about enlarging our capacity to receive. And we were trying to understand the difference between getting and receiving. And we discussed that getting is very personal. It comes from, it involves want thinking, it should thinking, and that actually the desire, the mental process that is involved in wanting and trying to get, block our capacity to understand good of God or to see spiritual good. And that's what it is that we need to receive. And that receiving is an epistemological issue. You receive in the process of knowing or understanding spirituality. But would people ask questions now? Are there any comments you would care to make before the questions start about the issue of receptivity?
Well, you make a very interesting distinction between getting and receiving, and we could just add that getting has an active and aggressive connotation. You go and get something. It is closer to taking and receiving is rather passive, but a positive attitude towards something that is good, without any kind of ego action. Or we could say that getting is an ego function, and receiving is spiritual. Perhaps this distinction might help to clarify the difference.
Yes.
We are not go-getters in this world, but we are blessed receivers of God's good. And in our studies of metapsychiatry, we're learning to be receptive to the good of God, which is freely given, which is called grace. Whereas getting has an aggressive connotation, and it is operational, and essentially it's an ego function. Throughout all our studies of metapsychiatry, we constantly make a point to clarify the difference between ego functions and spiritual reality of man. So it might be helpful to look at this as getting is an ego function, is operational, whereas receptivity is spiritual. But anything you might add to it, Anne?
That's very clarifying. I was also struck by the fact that you define what we receive as in the good of God, which is freely given, which is grace.
Yes.
I think that's also very clarifying. It's obvious that we can't get grace.
No, we can't.
I wouldn't even want to.
Right. Now, in the history of the church, there was a time when they believed that you could buy it.
That's true.
It had a special name. Jan, maybe you remember what the name was.
Indulgences.
Indulgences, right. How ridiculous this looks today, right?
Everybody's sitting here at the placid receiver.
Waiting to get something.
I don't know if I or not. Dr. Lou, this is Chloe.
Yes, Jay.
This week I was driving down the street and I had stopped at a stop sign. And I looked around and saw the beauty of plants everywhere. And the thought occurred that life is not hidden, that it seemed obvious that life is not hidden. Yet, what is it in our thinking, or what is it that we need to see in order to receive the gift of the capacity to see this?
What, Jay? That life is
To
not...
see the abundance of life everywhere. It was obvious that life is not hidden, but I've seen it as hidden, that it's something that I need to get, that I don't have.
So, you have to first explain what you mean by life.
So I saw nature
Yes,
and the beauty of nature is what I saw.
yes,
And it seemed obvious that everywhere I looked, it was present.
it was present.
Present, right.
Yes, yes,
But it seemed as though it was out there. It wasn't anything that was good for my ego, that was good for me. That
yes.
it was something that I needed, that there's something that I need to understand to
Yeah.
realize this good is present.
Right,
Who I am.
yes.
Yeah.
Well, Jay, Jesus would say to you, blessed are your eyes, Jay, for they see. But unfortunately, there are millions of people who don't see what you see. First of all, they don't live in California, where there is so much beauty. But second of all, if we are mentally preoccupied with the evils of the world, we may not see the beauty of God, the glory of spiritual reality. Now, so to the vast majority of people, it is hidden. But those that understand the teachings of Jesus and of metapsychiatry, they are opening their eyes and they begin to perceive the spiritual qualities of God in the whole universe. Now, if you are so happy about seeing God's presence in nature, well, then your eyes are blessed. You have reached a point where you can see, and that's what Jesus meant. But blessed are your eyes, for they see. Well, about the people who don't see, Jesus said, for their eyes they have closed, and their ears are hard of hearing, and their hearts are vexed gross. Remember that passage from the Bible, I'm sure, right?
No.
You don't? Does anyone among you there remember this passage?
Everyone's asking for the waxed growth. Is that what you said?
It waxed gross, yes. Well, the disciples were asking Jesus, why do you speak to the publicans in parables? And where is you speak to us in plain language? And Jesus explained, because it is not given to them to know the mysteries like to you, for their hearts have waxed gross, and their eyes they have closed, and their ears are hard of hearing. If by any chance they would see with their eyes, and hear with their ears, and understand with their hearts, I would heal them. None of you is familiar with this passage?
Claudette is.
Claudette. Okay, Claudette, can you add something to it?
Sure, it seems that the issue of life that Jay was mentioning, that here, blessed are my eyes because I see life blossoming and full of blessings. But then there is a fact that my life is not life with a capital L. So then I turn my eyes to my life, and I see things I want, and I see things I don't want, and I suffer for both of those.
Yeah.
And it seems that the blindness where the eyes are closed are wherever we have some goal or ambition or personal insistence that our life is separate from life and it should be what we think it should be or shouldn't be. And to help us see that life is one seems to be I guess it's the ego still wants to hold on to these wants and wants them to happen according to what we want to see.
Yeah.
The good that we've decided should be there.
Yeah. Well,
To help us
yes.
make that transition from seeing our life separate from spiritual life.
Yes, Claudette, it is important to make clear always what we mean by life. Most people mean experiential life. Unenlightened man calls life as consisting of experiences. In metapsychiatry, we are learning about a different life, which we call soul existence, rather than sense existence. Unenlightened man, sensory experiences constitute life. Enlightened man sees life as a soul existence, and he transcends sensory experiences and ego gratifications. And he realizes the beauty of spiritual reality. So what we mean by life, it may be entirely different than what the average individual means by life. And another thing, we have to say that nature isn't beautiful. Nature manifests the beauty and intelligence of the creative principle of the universe. Them that have eyes to see. So when Jay spoke about life, we are not sure what she meant by life. Hopefully she meant spiritual reality, the immortal life of the living soul. Does that clarify it or confuse you?
No, it clarified that.
Okay, Claudette. I'm glad.
This is Fern.
Yes, Fern.
Jan happened to speak right before we called you that experiential life, or what we experience as our problems, as our goods in life, is really fat, invisible form. And that we have a great resistance to facing up to seeing this as thought.
Yes.
And I guess that was the question I had, is what is it that can help us see a problem or a painful or a sense of lack experience, to take a look at it as thought, and then be willing to see that life is spiritual?
Yeah. Well, again, we have here a tremendous blessing of metapsychiatry, because through the practice of the two intelligent questions, we can gradually come to really understand that everything material, physical, is just thoughts. It is mental. Whenever you understand that a problem has a meaning, you can see the meaning, you can see that this particular meaning is a thought which took on a certain tangible evidence. And when you understand that just because something is tangible and measurable, it is still a thought. So little by little, by every little healing of a physical problem, or other problems too, leads you to a full realization that everything is mental. And then you can see the insubstantiality of the material world. To understand that just because something is concrete and tangible, and you can measure it and cut it, and it bleeds and it hurts, that it's still just thoughts. We are dealing with phenomena. Phenomena are thoughts appearing as form. And then it is not a theory anymore, but actual realization of the insubstantiality of matter. And by contrast, you discover that spiritual ideas, which seem to be non-dimensional, they constitute real substance. So this is a very upside-down universe. Upside down and inside out. And no other way can anyone understand it but with the help of the two intelligent questions. Step by step, you can reach an understanding of this mystery of what is substantial and what isn't substantial. A tremendous blessing. If you were to tell someone that matter is insubstantial, he would laugh you to scorn. For the human body is a thought. That's ridiculous, isn't it? And yet, nevertheless, it is so. We are not physical persons, we are spiritual beings. And the substance of our being is spirit, non-dimensional entities of awareness. Difficult to talk about it, more difficult to realize it. But to realize it is a great blessing which gives us dominion over the whole material life.
To Hora, this is Linda.
Yes, Linda.
I was listening to that, and then when you said that we need to learn more about working with the two intelligent questions, I knew that this would be a good time for me to ask my question.
Yes.
Because I've been trying to do that, work with that intelligence, the first intelligent question in relationship to physical symptoms that I've been having for a couple of weeks. The last of which has been a persistent kind of pain in the high corner of my mouth. And so I would work with it, and it wasn't like a toothache, but it made my teeth hurt. And I would try to sit down and ask what was the meaning of it, and I would get impatient, and so I called the dentist. And he couldn't see me till for a week almost. So then I decided that I would have to get more serious about asking the meaning of it, and so I've been trying to do that. And the closest that I have come to any kind of understanding was that it was had something to do with me being painfully aware that something especially good was missing in my life. That's something that I always thought would make me happier, or like, Babe, that's good, or I'm trying to get my life together. That kind of good. That was really missing. It could never be fixed. And so I say, aha, that must be the meaning. And I still have this persistent pain. So what I'm wanting then is to help in being more, I guess, sincere in asking that question about what is the meaning of what seems to be.
Yes, sincerity is very important, Linda. And you can start by reminding yourself that Dr. Hora said that pain is invariably an angry thought.
I look for angry thoughts.
No.
I know that was, in fact, that was my first, I always know from working with Freud and just studying that you look for an angry thought. And I heard them, what's the meaning of not seeing specific angry thoughts in relationship to physical pain?
Well, it's usually due to an unwillingness to be embarrassed.
That's real possible.
Is the pain in the mouth or in the tooth?
It's in the high corner of my mouth, like above my back molar teeth.
Yes.
Like if you push on it, it hurts.
Yes.
Sometimes it feels like my whole jaw is aching, and it troubles me. And
The upper jaw.
He is not going to get better.
The upper jaw.
Yeah, upper jaw.
Yes. Have you seen the dentist yet?
No.
No.
I didn't have any openings on next Tuesday.
Must be a very busy dentist.
Well, it's the holiday here in California on Monday.
I see.
A 3-day weekend.
I see.
And they offered me, I could, her solution was that they could give me some kind of prescription. And
Yes.
I wanted to do that, and I decided that I didn't want, that I would try to work with it.
Yeah. Well, do you feel like bad-mouthing somebody?
Oh, sure. Yes, I'm prone to bad-mouthing people, but I tend not to do it out loud. I tend to be secret about things like that, or just do it mentally, then I feel sort of guilty.
Is that an extenuating circumstance?
I don't understand what that means.
Which is worse, to badmouth people loud or to do it secretly?
I think it's worse to do it secretly.
Well, anyway, it is not a loving thing to do.
Oh.
Well, perhaps that may be the problem, Linda. Have you ever heard about forgiveness?
Yes, I've heard about forgiveness.
Well, maybe you could find relief if you specifically catch yourself thinking angry and critical or hostile thoughts about someone, and then proceed to forgive them and to love them.
Okay, I'll do that. And I guess what I want to say is, I've always inclined to think, oh, there's so many people. I mean, how do you work, kind of narrow it down?
Well, if you hate too many people, then what you need is forgiveness from God. Now you ask God to forgive you for being angry at so many people.
I can do that.
And you just realize that God has created you to manifest love intelligence. That you're a spiritual being, and you don't have to see life in terms of interaction with other people.
I remember listening to that as a child. I always felt angry at God that I didn't have the life that I wanted. And
Okay.
I've always felt kind of bad about that.
Okay.
And I didn't have a right understanding about really let go of God's words.
So maybe you're bad-mouthing God too.
I've thought about.
Yeah.
All right, thank you, Dr. Hora.
It's not advisable, Linda.
No, I didn't say that.
Okay.
Thank you.
Hora, this is Anna.
Yes, Anna.
As a medical doctor, what would be helpful for me in seeing patients and circumstances and situations when the substantiality of the body seems so real to them and to me?
Are you a medical doctor?
Yeah.
My condolences.
Thank you.
Well, Anna, I have to give you credit that as a medical doctor, you dare to study metapsychiatry. We have it doubly difficult, you know. Nurses and doctors have it doubly, except that we see that the traditional ways of helping people is not very effective. Nevertheless, Anna, as long as you function in the role of a medical doctor, you have to render unto Caesar what is Caesar. And don't try to mix the two disciplines. Serve the metapsychiatric knowledge to your own healing. You cannot offer it to others who do not seek it. So keep it apart.
Yep.
All right, Anna?
Okay.
Are you a pediatrician? Are you a pediatrician?
Oh, I'm in internal medicine, general medicine.
I see. Well, that's all right. It is important to have medical doctors because the vast majority of people are not receptive to any kind of spiritual healing. And they do need help, and we can give them help to some extent according to their expectations. So don't throw your diploma away yet.
I have felt like throwing my diploma away recently. I have a great deal of frustration in dealing with sick people. And I haven't known how to incorporate metapsychiatry. I've been attempting to relate to patients with a metapsychiatric viewpoint, and that seems to just cause me more frustration.
Absolutely, you cannot mix it. The only thing metapsychiatry can give you in your practice is greater understanding of compassion. Do you know our definition of compassion?
It's understanding that ignorance is present, being what is ignorant.
Yeah, understanding the lack of understanding.
Yeah.
And we cannot blame people for not understanding. Neither can we force them to understand. So that you can approach your patients along the standard procedures and traditional ways, but with greater compassion than anyone else among your colleagues. Because metapsychiatry helps you to understand compassion better.
What is the meaning of apparent healing by traditional procedure when it's true that true healing doesn't really occur unless it's a spiritual healing?
Yes. Yes, well, most of the time, what you see is cures, which is alleviation of symptoms, or the replacement of one disease with another. Real healings occur sometimes spontaneously, and a compassionate individual can contribute greatly to a spiritual healing even in someone who has no idea about it. You see, to meet up with a truly compassionate individual is an entirely unique experience to such an individual, because the compassionate physician is totally without judgment. His attitude is completely non-judgmental and loving at the same time. And that is a unique experience. Very few people come across such an experience. And that in itself can accomplish some healing. Essentially, that's what faith healing consists of. An encounter with a non-judgmental and loving consciousness. Faith healing is not synonymous with spiritual healing. I am sure you may have read the pamphlet about spiritual healing, right?
Yeah.
So you know the difference.
It's giving advice when it's not accurate.
Right, and it is trespassing, and it can be very disturbing to people. So we don't do that.
So it would essentially just make their situation and they're dealing with their issues worse.
Yes,
Better.
absolutely.
Very helpful.
God bless you, Anna.
Julia, this is Jim.
Yes, Jim.
Listening to this conversation here with the doctor, I'm reminded of the story about the fisherman who, wherever he goes, the dead trees come to life.
Yes.
And I'm wondering, is it possible, without offering unsolicited advice, is it possible to just be in a state of love, or whatever we want to call that, whereas the parable of the dying trees, the diseased bodies are responsive to our state of awareness?
Yes, I have just explained it to Anna that compassion can occasionally produce miracles. Pure compassion.
Thank you.
You're welcome.
Dr. It's Roberta.
Yes, Roberta.
Is that the meaning of Jesus speaking in parable? Because he had such great compassion, he did not force his understanding on those who were not receptive, but he told them about it in a way that would require them to work at it if they truly were interested.
Yes, Roberta, that is correct.
Is that also the meaning of the Zen koan?
Yes, absolutely.
So when you said, he said those whose hearts wax growth, he was saying that to you I could speak forthrightly,
That's
but
right.
to them I have to present it in a way that they could understand only if they were interested.
That's
Is
right.
that correct?
Sure, Roberta.
Oh, thank you very much.
Very good. Very good.
Well, this is Michael.
Yes, Michael.
In the statement of Jesus that to him that hath more will be given,
That what?
to him that hath more will be given,
Yes, right.
and in the presentation this morning, I became aware of the fact that I was looking to get what I needed to have so I could be given more. What is it that is hath in that context, and what is it that is given?
You're a funny one. Let's put it this way, Michael. To him that has a smattering of understanding, more shall be given. And from him that doesn't have even a smattering of understanding, it shall be taken away even that which he seems to have.
The thing that is needed to have is receptivity, and the capacity for receptivity is enlarged.
Well, receptivity is already a great gift of God. We start with sincere interest. Catch glimpses of the truth. We gain a smattering of understanding. And if we are grateful for it, we will receive more and more and more and more.
It occurred to me that in receptivity, we are open to discover, and when we're trying to get, we're trying to acquire. Is that the distinction?
Yeah, that's pretty good. Yes, Michael.
Thank you, Doctor.
You're welcome.
George, Roberta.
Yes, Robert.
I have a sense of lack. And today I realize that that everything in God's world is already complete and perfect. Yet I have a sense of, in certain areas of my life, lack. And I would like to understand how I could relate the two, how I could truly understand that everything spiritually complete.
Well, if there is a sense of lack, it indicates there is no understanding of true values. If you understand true value, then there can be no sense of lack. True value is love, wisdom, joy, harmony, peace, assurance, and gratitude. These are true values, and there is no shortage of it. And if we understand that we are infinitely blessed with true values, then there will be no sense of lack, and that will manifest itself also in physical abundance.
Lack seems to be in the human area.
Of course,
Yeah.
there is no such thing as spiritual lack. Spiritual treasures are infinite.
I have been doing a sort of a spiritual bookkeeping in a sense. I've been being more observant and appreciative of the spiritual values in my life and attempting not to focus so much on the human lack. And I'm wondering whether I'm fooling myself.
Well, that
Really,
wouldn't
this
be.
is the right way to go about it.
Fooling yourself wouldn't be the first time,
No, you told me that before.
Roberta. But a secret of a sense of abundance lies in appreciating the spiritual treasures more than anything else. How is the first principle of metapsychiatry?
Shall have no other interest before the good of God, which is spiritual.
So, now the question is, are we more interested in money, in possessions, in automobiles, or clothes, or whatever, than the good of God? You see, the first principle lays down the most important priority. And when our priorities are existentially valid, then the sense of lack disappears. Subjectively and objectively, there will be the abundant life. But the priorities must be realized.
Yes, I think that's the crux of it, the priority.
That's right, Roberta.
Thank you very much.
And no kidding.
Okay. Dr. Hora, this is Anne.
Yes, then.
And I was just struck as you were talking that I don't think often we realize, for example, I was thinking that in Southern California, there are lots and lots of people with enormous amounts of money. And somehow I find it's very easy as a student here to have the fantasy that if you put the good of God first, that the abundant life is going to mean a mansion in Rancho Santa Fe. And it just dawned on me as you were talking that that kind of exorbitant material good is often a manifestation of a valuing of money and a valuing of material good. And that a spiritual student who really values spiritual abundance, in all likelihood, will never have a mansion in Rancho Santa Fe. Everybody's saying, no, you mean I've been led astray? But that it's not necessarily that you will get more and more, but rather that you will have every need met and overflowing, and that your whole appetite or sense of what abundant life is will change. Is that correct?
That's correct. In other words, there will be harmonious prospering rather than prosperity, just prosperity. One can be very prosperous financially and real estate-wise, and yet be very poor. So what we are talking about, the alternative to a sense of lack, is harmonious prospering.
Dr. Hora, this is Georgiana.
Yes, Georgiana.
I have some questions. Part of it's related to what Roberta's saying.
Not the earrings?
Pardon?
Not the earrings?
No.
No earrings.
What I was thinking is that I go and do public speaking on stress. And part of what I need to do when I go out to different groups is determine what level of understanding they would like to know about it.
Yes.
Do they want just a medical understanding, or do they want a psychological, or are they interested in going to a spiritual understanding?
Yes, that's a good idea.
What I ask them questions and I try to uncover what level they're interested in and then speak at that level. But what would be helpful to me in determining this? What could I look for?
Perhaps you could provide them with all three levels in one lecture and show them that it is possible to think this way and that way, and and the highest level is the spiritual.
Okay,
You don't have to.
give them a hierarchy of stress.
That's right.
Okay.
That's right. That would be a complete lecture.
Okay. That would be helpful, especially if I only got one shot at them.
Right. Right.
Okay, thank you.
You're welcome, Jordana.
Hello, this is Jan.
Hello, Jan.
I would like to think a little bit further about the true values that you mentioned to Roberta.
Yes.
Are these true values, for us to come to know that, is this acquired learning? It's not something that we naturally know, because there's nothing in the human world that makes us value true values.
Well, Jan, natural man receiveth not the things of the Spirit of God, for they are foolishness to him, right?
Yes, and true values sound that way to us.
Right. If we are still natural,
Yes,
we have to rise above our naturalness. We have to be educated. The whole mission of Jesus was to educate us to the understanding and appreciation of spiritual values, and thereby know the abundant life which he spoke of. Do you know our definition of values?
value is what one values.
That's right, Jan. So we are learning to value spiritual values, and we are learning to give them the first priority in our lives. And when we value spiritual values as the first priority, then everything else falls into its proper place, including a mansion in Rancho Santa Fe. Rancho Pancho.
But I hear a contradiction here, or I can see some kind of a very difficult bind. Because on the one hand, we find in ourselves the natural values, the natural man's values. And you say, well, you need to rise above it, but somehow we don't seem to be able to do that. Unless you say, well, we might come to a point that we learn and we hear spiritual values. But first it is a matter of just hearing it, not yet valuing it.
Yes, right.
Maybe then the first step is to study and hear and contemplate these values and compare them with what we are actually doing.
That's right. Sure, it doesn't come right away. There is a struggle. There is a struggle within us about the priorities. Remember the parable of the sower?
Larry says he doesn't know it.
Who?
Larry.
Larry, he doesn't know it?
Oh.
Well,
It's right.
Well, Jesus gave a famous parable of the sower. And we can think of that parable the following way. Metapsychiatry has offered to the world some mini books. Now, there are people who buy these mini books, and they buy many of them, and they give them to others to read as gifts in order to impress other people about how spiritually minded they are. In other words, they just use the mini books for self-confirmatory purposes in the eyes of their friends. Then there are people who buy the mini books and never read them. And then there are people who buy the mini books in order to refute what is written inside of them. And they read it with a contentious mind. And they get nothing out of it. And then there are people who buy the mini books and study them, contemplate them, meditate, and treasure the lessons contained on those pages, and are healed and transformed because their value system is rearranged through their sincere approach to the issues. Now, this is the modern parable of the sower. Jesus spoke about a man sowing seeds, and some of the seeds fell on rocks, and the birds picked them up, and some of the seeds fell among thistles, and the thistles choked them, and some of the seeds fell on fallow ground, and nothing came of it. But some of the seeds fell on fertile ground and brought forth good fruit 100-fold. So that's how it is with our approach to the issue of values.
So, in other words, if we don't read and don't study and contemplate the ideas that are given to us in the books,
Then nothing will happen.
Actual man wouldn't drift into the true values by himself.
Not likely, no.
Yes.
I have a question. What is the meaning of birth and death?
What is the meaning of birth and death?
Oh, my name is Stuart.
Yes, Stuart. Now, you would like to change the subject now?
Yes, I understand the other.
Are you sure?
I'm not sure about anything.
It would seem that you are afraid to consider what was being spoken of between Jan and myself.
Oh, about the seeds falling on fertile ground?
Yes,
Receptive mind?
right.
No, I'm not
Right.
avoiding that. I'm not sick.
Are you a sincere?
I'm
Are you a sincere seeker after the truth?
I believe so.
Yes. What you would like to change the subject to the question of what is the meaning of birth and death? Yes?
Yes.
Well, I'm afraid if I'll tell you, it won't mean much.
Don't worry about it. That might.
Well, birth and death are phenomena. Do you know what a phenomenon is?
An illusion
Yes,
that appears.
yes, they are thoughts appearing as form. The living soul is never born and never dying, is immortal, and is hid with Christ in God. That is, it is hidden from unenlightened consciousness, and natural man has no idea about it.
What is the meaning of the appearance, or of what seems to be birth and death? Is it something to do with time?
Well, time is also an illusion. Oh, have you ever heard of cognitive dialectic?
What is that?
All right, you're not reading the mini books.
Which mini book is that in?
Forgiveness.
Yep.
Have you read Forgiveness?
No, that would be useful for me.
You ain't kidding.
Stuart just walked in 2 minutes ago. He was mixed up with the time of the seminar.
With what?
He had mixed up the time that the seminar
yes.
started.
Yeah, it sounded like the spy that came in from the coast.
You're right. I just came in from Alaska yesterday.
You are still not warmed up enough.
I'm working on it from the inside out.
So you weren't here when I spoke about the parable of the sower?
That's when he just walked in.
I see. Well, we'll forgive you, Stuart.
Well, thank you very much, Dr. Hora.
You're welcome. Goodbye, everyone.
Bye.